Hi, I'm Dr. Jenny. I am a chiropractor who focuses mostly on moms, pregnant and postpartum. Right now, I have a lot of moms who are in that last trimester, and so going through a little bit of birth prep movements. I think I have like 8 or 9. So we want to start with something that's a little bit more supportive or stable, so you can kind of hold on to it as we go through the first couple of movements. So I want you to grab, I'm going to use my office chair, but where you're holding on to something that you can get your booty low. Okay, my butt is below my knees, lowest part there. And then we're going to go into a rock side to side. Okay, holding on to that stable spot, really working on rocking side to side about 10 times back and forth, just really opening up those hips. Okay, and then going into more of a lateral lunge. So you can use your stable spot, you can use a yoga block, you can use the floor, but really working on getting into those low, deep lunges, side lunges. I don't want you to bring your butt up in between. You're just kind of sliding those hips back and forth, really working on opening up that inner leg as you go back and forth. Again, about like 10 of these is a good cadence there. Then bringing back your stable part, or you can use a yoga block, or you can use your stairs, whatever feels good to you or convenient for you. I even used like pulling out my drawer in my bathroom when I was pregnant. But we want to have whatever leg is uneven kind of up on that block, toes are pointed out, and other foot's here, and just gently leaning in to that foot. We want to make sure your knee doesn't go past your big toe. So I would move my block out a bit more. You just want to be careful with those knees as well. But back and forth, that uneven lunge, really rotating through that butt cheek. So doing 10 on one side, bringing your surface over to the other side, stepping back, and then leaning into that. Again, stairs are a good thing, using a drawer, using my chair. We just want to make sure you're a stable surface and then leaning back and forth. Again, stretching that inner leg, really rotating that back glute there. Okay. Then going into kind of a sumo stance. So heels in, toes out. We're going to slowly load and then slowly come up. Again, really working on opening up those inner legs, feeling that little bit of rotation in that pelvis. And so you kind of see the underlying tone is opening and increasing that rotation through your pelvis. So nice and slow. Again, like 8 to 10 is another good position here. Nice and slow as you load, really rotating. So heels in, toes out. So you rotate that pelvis. Then we're going to hit the floor. And we're going to do it at my favorite movements, the 90-90 switch. So we are in our 90-90 position here, okay, for knee bent. And we're going to rotate back and forth with that dominant side. So we're going to do about, again, 8 to 10 on the one side, nice and slow. You can get to a place where you're not using your hands, even better as you rotate. My hips are a bit tight today. Good. And then you want to switch that lead leg. So then switch it out, and now we'll rotate the opposite direction. So I'm rotating now this way, which this way for me feels a lot easier. So I would want to work on my harder side a little bit more so that that balance and stability feels a little bit more even. Okay. Then we want to do our flows. So going back and forth, I call these windshield wipers, but knees go back and forth, side to side, rotating those knees down as far as you can, back and forth. Again, 8 to 10 times. I think this feels really good, just kind of opening up those IT bands a bit as you get that knee close to the side. and then just kind of paying attention what feels good, what side has more range of motion, and kind of working towards, again, creating that balance. Then bringing out your yoga block or a book is another good thing to use. We're going to do some uneven hip hinges. So one knee goes on that block or that book. We want to make sure our knees are remaining parallel. So kind of bring that block back so our knees are parallel. And we're going to scooch our hips up and then drop them down. Lift those hips up and then back and down. Not a super huge movement, just creating a little bit of unevenness in that pelvis to open up that pelvic outlet. And so lifting up and then back down, just kind of rocking right through that joint there to create some space for baby. And then last, probably one of my favorites, so heels in, toes out, froggers. So we want to work on that internal rotation of your pelvis because that's very important when it comes to the outlet of your pelvis for birth. So knees in, toes out, slowly rocking back and forth to get some movement in that internal rotation side to side. Again, 8 to 10 would be great. And then we're going to end with one of my favorites. So scooching your butt up nice and close to the wall. Kind of making that W or that V sit and getting, just kind of pushing a little bit on those inner legs to kind of get that from that knee in towards your perineum to stretch out, really breathing into that, trying to actively relax your lower back, actively relax your hips there, and then just feeling that perineum stretching a bit as we breathe into that movement. So that is one of my favorite birth prep circuits. Kind of hits all of the big things to work on as you're going through your third trimester.